Hello and welcome to our June 11th Veterans Town Hall. First, I would like to share some information about our main hospital, including commonly requested phone numbers located on your screen. Today's Veterans Town Hall also highlights our LaSalle CBOC. The LaSalle CBOC serves approximately 1,500 veterans a month. Some of the healthcare services they provide include primary care, women's health, audiology, laboratory services, physical therapy, social work, nutrition, mental health, telemedicine, teleretinal, teledermatology, and home-based primary care. Additionally, the LaSalle CBOC offers daily transportation services to Hines for veterans with scheduled appointments. The clinic also started a vegetable garden recently to supplement its micro-food pantry with fresh vegetables for our veterans. You can find the LaSalle CBOC contact information on your screen. If you have any specific questions, please comment below or send us a message, and we will get back to you as soon as possible. All right, so that is our opening remarks for today's session. Up next, we have Francisco Manchisi for our HRO safety story. Thank you.
Good afternoon, veterans and staff. I'm Francisco with the safety story for today. A kinesiotherapist working with a postoperative inpatient noticed that the veteran had somewhat uncharacteristics, silent symptoms after the treatment session. Acting on her instincts, the therapist alerted the ward nurse. Vital signs were taken by the ward nurse, warranting a rapid response to be called and further testing and imaging to be performed. It was determined that the patient had a pulmonary embolism, a critical finding requiring prompt medical attention. By both trusting and acting and refusing to settle for the simple explanation of, well, just had therapy, he must be tired, the veteran critical state was discovered. The therapist, reluctant to simplify, not settling for a simple answer, led her to seek the root cause of the patient's symptoms. Additionally, this therapy demonstrated clear and concise communication with the medical team, which got the veteran the prompt medical attention required, thus avoiding an adverse outcome. That concludes the safety story for today. I will be followed by Dr. Richardson with the Chief of Staff medical updates.
Thank you much, Mr. Marquez, and welcome everyone for our town hall today. As I have to speak, a couple of things that I want to talk about in our medical update. First is, as it's 91 outside today, summer is here, and the concerns that we usually do once a year about what to do in summer and what to think about in summer, I want to remind everyone. Obviously, the first thing is the heat, and keeping hydrated during the heat, and making sure that you wear clothes that are loose and can therefore take the heat. The second thing, obviously, is if you are considering traveling, going on vacation, to look at the medications and make sure you have enough medications to take with you, as well as make sure that if where you are going, then you'll be able to have, if it's in country, then certainly know where your nearest VA is if necessary. And then the third thing, definitely in summer, is to take a look at what we eat in terms of, again, food choices. For those of us that are diabetic or have renal problems, we may have to choose some picnic food that may be a little different from everyone else. So that's definitely the things to see for summer. The second thing that I really wanted to highlight is to put on that you may need for this summer as the year comes down to again look and speak with your PCP to make sure that what you've been doing for the first half of the year is continuing well, in taking a look at your, not just your medications, but also the various aspects of your medical care. As you have heard, as you probably remember, we now have at each CBOC one Saturday a week that a different CBOC is open for extended hours, and then during the week CBOCs do open for longer hours. The first Saturday of the month is Aurora, and then after that each other CBOC, with the exception of Kankakee, has a Saturday that they open for that month. and therefore there is no reason for us not to be able to provide care for you if you have necessary. I think the third thing that I just wanted to speak about for our medical update is really, again, in summer, looking about your allergies and the air quality that might be around. Most recently, I think everyone remembers or knows that the air quality here in the Midwest has been terrible because of the fires that have come down from our neighbors to the north. This is something that may continue to happen, and therefore as we go out and swim, picnic, walk, hike, etc., be careful and aware of what's happening on the outside, particularly with many of our veterans who have lung problems or asthma, COPD, and that may need some extra medication, or more importantly, some extra care as you go out, just how long you spend out and when you decide to go out. So those three areas I just wanted to bring from a medical update, but other than that, have a great summer, everyone. And now I'm going to ask from Nutrition and Food Service, Ms. Candice West and Ms. George to come and talk about that.
Hello, I'm Candice West. I am the Food Service Section Chief here at Hines. So just want to give you some updates about some exciting changes coming. So implementing room service style of dining in a healthcare setting can profoundly enhance the patient experience, especially for you, our veterans. This innovative approach focuses on delivering fresh, hot meals straight to our patients' rooms, similar to what you might experience in a hotel. So let's delve into the key aspects and the benefits. First, let's talk implementation. Transitioning to room service dining has required a strategic overhaul of the current food service operations. Detailed planning and coordination have been essential, involving several steps, and some changes to look forward to will be customized meal ordering. You, our veterans, will receive a menu with a variety of choices, ensuring you can order meals that suit your tastes, diet needs, and timing preferences. Next, flexible meal times. Unlike traditional fixed schedules, room service dining allows you to eat when you are hungry, which can improve your overall nutritional intake and overall satisfaction. And additionally, we will be starting a comprehensive staff training to ensure that our food service ambassadors are prepared to handle and deliver personalized orders in a prompt manner. Now on to the benefits for you. Enhanced patient satisfaction. Room service dining aligns with veteran-centered care by respecting your personal preferences and improving the overall hospital experience. Next, improved nutrition and health outcomes. When you're able to choose food you enjoy, as well as the timing of your meals, you are more likely to consume adequate nutrition. This can lead to better health outcomes and quicker recovery times. And finally, personalized diet management. Our dietitians here at Hines can work closely with you to customize menus that meet specific health conditions and diet restrictions. In summary, our room service style of dining will foster a more personalized and dignified dining experience for you, significantly improving your satisfaction and health outcomes. By respecting your autonomy and preferences, we honor your service and enhance your hospital stay in a meaningful way. This approach not only modernizes the hospital dining experience, but also aligns perfectly with a commitment to providing high-quality veteran-centered care. We're on track for a go-live date of July 23rd, so stay tuned. We're all excited for the next stage of service. Thank you. Oh, and next up, we have information about patient discharge from Nursing Unit SOP from Ms. Sherry Johnson.
Good afternoon. My name is Sherry Johnson. I'm the ADPCS, the nurse exec here at the Hines VA Medical Center. I want to talk a little bit about a new SOP that we've updated. It really is speaking to the importance of our patients staying on our units, not leaving, so that we can provide them excellent care. The purpose of the SOP is to establish guidance and procedures for patients that are leaving acute care inpatient units for non-VA approved activities. We want to ensure that our veterans receive safe and timely care so that we can optimize their inpatient stay. We also will be optimizing the use of our WanderGuard system, which is a system we use for those patients that do have some difficulty with decision-making capacity. Next, please. The importance of staying on the unit is really related to being actively engaged and participating in your plan of care, being available for testing and any treatments that may be imperative to your medical treatment, also being able to communicate with your healthcare team, being available for the physicians and the nurses when they round so that they can talk to you about your healthcare process. It also helps to ensure that your health and safety are intact and also limits the spread of infections. Some of the procedures and responsibilities that are important to understand. So when you are coming through the emergency room, the ED physician will inform you of the requirements that you need to stay on the units for your treatment. They'll also explain the importance related to your safety, the continuity of your care. Your nurse in the emergency room will also give you some of the same information, making sure that you understand the intention of staying on the unit. Your admitting unit physician will be discussing your inpatient care plan, the need to remain on your assigned unit, and also informing you that if you should leave the unit, excuse me, that would be an unauthorized departure and could lead to a discharge. Next, please. Some of the procedures and responsibilities continuing on the floor, your acute care nurse or LPN will always tell you what your activity orders are. They'll help familiarize you with your unit. They'll confirm that you understand and that you've signed the inpatient unit acknowledgement form. And then they may use a WanderGuard system if the person or the veteran is not able to sign all those documents, and they may not understand the intention of staying on the unit. PAS staff will be engaged as well. They'll help distribute and scan any admission packets and acknowledge forms into the electronic medical record. Next, please. So some of the impacts on veterans. The main thing is that we're wanting to ensure that you receive proper and safe care. We also want to protect your health and the health of others. Unfortunately, any unauthorized departure would be treated as against medical advice and could impact your care continuity. The responsibilities, again, of the treating physician, coordinating the care, informing you about the importance of staying on the unit, and then the unit staff ensuring that you understand the necessity of remaining on the unit, informing the physician of any non-compliance. Some of the definitions of what I've spoke about, obviously this impacts the inpatient acute care floors in Building 200. That would be your 7th floor, 8th floor, 9th, 10th, medical intensive care, and SICU, so all of our inpatient care units. And VA-approved activities would be an appointment or activity that enhance healthcare needs. It could be physical therapy, diagnostic testing, a lab test that you needed to go to the laboratory to have drawn, a CT, things like that. And then I've mentioned the WanderGuard several times. The WanderGuard is a patient departure alert system that we use to alert the nursing staff for any veteran who may try to leave the unit if they're really incapable of making those decisions for their safety. And just for conclusion, just wanted to kind of recap the importance of that SOP is really for veterans' safety. We want to make sure that you're on the unit so that our care team can provide that safe and efficient care for you, which is the intention of you being in our inpatient units. We want to make sure you receive that care, that you're discharged timely, and that we're able to provide care so that you would return back to your regular state of health in a timely fashion. We want to make sure also that there's open communication. If you're not available when the team is rounding, it makes it more difficult for us to talk about your treatment plan, your discharge plan, how we can best assist you with your care journey. I just want to thank you for your attention and look forward to providing care. Next will be Dr. Geraldine Zingraf.
Hello, and my name is Jerry Zingraf. I'm the kidney transplant administrator here at Hines, and I'm here to talk to you about our Hines kidney transplant program, which is fairly new. We opened up in November of 2020, and as you can see, throughout the last 3 to 4 years, We've grown greatly in the number of referrals we've seen, have received, number of evaluations of the folks we've listed, and more importantly, the patients that we've transplanted so far in the last 4 years. We performed a total of 330 kidney transplants since we've opened. And I can tell you too that all our patients are doing fantastic for our outcomes, for patient survival and graft survival. We either meet the national benchmarks or we beat them, and we've been doing fantastic. We've averaged about 2 to 3 transplants a week here since we've opened. I can also tell you that we have a living donor program. And this program opened up 2 years later in June of 2022, and so far we've completed about 11 living donors. And what's so nice about this is that these are the veterans' loved ones. They could be their neighbors, it could be their spouses, and even folks that aren't even related to them that donate their kidneys out of the goodness of their heart to the veterans. And we're hoping to maximize this and get more living donors, and this is a fantastic way of meeting the needs of the chronic kidney disease population. So we know that it takes a wonderful team to take care of all of our veterans, and it starts with our surgeons, our nephrologists, transplant nurses, dietitians, social workers, psychologists, pharmacists, and our nurse practitioners. Together as a group, we collaborate every day, frequently, every hour, to talk about your case and your care and what we can do for you. In addition to that team, we have a fabulous OR team, and that's our Dr. Lopez Solar, who is our director of our program with Dr. Aquari, and they are in the OR working with our OR team, making sure that the surgery goes as planned. So in addition, when you come here for a transplant, we kind of looked at it as a bunch of different phases. For evaluation, the most important thing is to meet the team, to get to know us, getting education done, and testing. When you are listed with us, we encourage highly that our veterans maintain their routine health maintenance activities. They see their PCPs, their kidney doctors, and remain connected with us at least annually, sometimes as frequently as every few months. And again, the theme is education. When you have a question, we always want our veterans to please feel free to call us and ask us those questions, no matter how silly you may think it is. After you're transplanted, again, the theme is new education. You now have a new kidney. We do intensive follow-up with you, meaning that we are looking at labs. We are seeing you at minimum of at least once a week for the first 4 to 6 weeks after your transplant, and then as things are progressing well, we'll be seeing you maybe once every couple of weeks. But the important thing is that we follow you for as long as you have that kidney transplant, whether you live in our area or not. We monitor your medications, but we also work in conjunction with your primary care doctor. At the end of the day, we are the busiest VA kidney transplant center in the country. We still anticipate growing, and it's not all about the numbers. We want to make sure that we do the best care possible. We have a fantastic team that takes care of it, wonderful support from our leadership, and we want to make sure that we do life-altering events for you with a kidney transplant. Thank you for your time, and this is how you can get in touch with us if you have any questions. Following is to talk about our Chicago Summer Stand Down is Mr. Donald Donahue.
Hi, my name is Don Donahue. I am the HUD-VASH clinical manager here at Hines VA. I'm also one of the social workers that helps plan the Chicago Summer Stand Down. The Chicago Summer Stand Down is an outreach event targeting veterans who are experiencing homelessness or are at risk of homelessness. The event this year is going to be held at 1551 North Kedzie Avenue, Chicago, Illinois, 60651. The date is June 27th. Doors open at 8 o'clock, and the event is targeted to end at 2 o'clock. The Stand Down is an event where we'll have a lot of community agencies, local government agencies, some of the Hines and Jesse Brown medical and social service programs will be there. Kind of a one-stop stop for people who are experiencing homelessness or at risk of homelessness, so we can connect you to providers. We'll also have some giveaways, and we will actually have barbers there this year. Thank you. I look forward to seeing everyone who attends.
Good afternoon, my name is Holly Barrett, and this is Donnie Razzo. We're suicide prevention coordinators here at Hines VA, and we're here to talk about VA SAVE training. VA SAVE is for anyone and everyone to learn valuable ways to help veterans who may be having thoughts of suicide or facing a crisis. The acronym SAVE helps you remember the important steps involved in suicide prevention. S is signs of suicidal thinking should be recognized. A, ask the most important question of all, are you thinking of killing yourself? V, validate the veteran's experience. And E, encourage treatment and expedite getting help. Next, how to support a veteran in crisis. You'll want to remember to remain calm, listen more than you speak, maintain eye contact, act with confidence, do not argue, use open body language, limit questions and let the veteran do the talking, use supportive and encouraging comments, and be honest. There are no quick solutions, but help is available.
And taking a deeper look at the signs of suicidal at the VA SAFE, we look at signs of suicidal thinking. These are behaviors that may be signs that a veteran needs support. So we want to learn to recognize the following warning signs: hopelessness, feeling like there's no way out, anxiety, agitation, sleeplessness or mood swings, feeling like there's no reason to live, rage or anger, engaging in risky activities without thinking, increasing alcohol or drug use, and withdrawing from family and friends. Now, the presence of the following signs are going to require action on our part. Someone that, when asked, expresses a desire to hurt or kill themselves. Someone that, when prompted, reveals that they're looking for ways to kill themselves. Someone that's actively talking about death, dying, or suicide. Someone that begins to exhibit self-destructive behaviors such as increased drug or alcohol use, talking about acquiring or using a weapon for self-harm, or stockpiling medication. In asking the question, once we identify some signs, we want to be courageous and know how to ask the most important question of all. Are you thinking of killing yourself? Other acceptable ways to ask this question are you thinking of suicide, or have you had thoughts about taking your own life? And we want to remember, we want to ask these questions as soon as we've identified the warning signs or symptoms. Ask the question in such a way that's natural and flows with the conversation. Do not ask the question as though we're looking for no answer. Like, you're not thinking about killing yourself, are you? We do not wait to ask this question until the person is halfway out the door or you're done speaking to them. We want to validate the veteran's experience, so as we listen, ask them to do most of the talking, and we are going to use supportive, encouraging comments, and use the following steps to let the veteran know that we're listening and we acknowledge their experience. We want to talk openly about suicide. We want to listen and allow the veteran to express themselves. Recognize that this is a serious situation. Do not pass judgment. Reassure them that help is available. And in encouraging treatment and expedite getting help, if the veteran is having suicidal thoughts, we want to remain calm, as Holly said. Reassure them that help is available. We're not going to keep the veteran's behavior a secret. We're not going to leave them alone. We try to get the person to seek immediate help from his or her doctor or the nearest hospital or emergency room. Call 911. We can also call the confidential Veterans Crisis Line at 988+1. Additional resources are mentalhealth.va.gov, veteranscrisisline.net, va.gov/reach, maketheconnection.net, and ptsd.va.gov.
Thank you for your attention. Next up, I would like to welcome Candace Kent with Patient Experience.
Good afternoon, everyone. My name is Candace Kent. I am the Veteran Experience Officer here at Hines VA. I'm here to talk to you about all the amazing things Hines VA is doing to meet the needs of our veterans and enhance their care. So first thing, a big thank you to all of you. Last time I was here, I put out a charge that if you get a survey, take a survey, reaffirming the importance of veteran feedback. And you met that request with a grand response. We received over 3,000 V-Signal survey responses on our electronic survey, and it also received over 1,000 Shep survey responses, which is our mail-in survey. Between those surveys, we got over 1,300 comments about your care here. Next slide, please. And a majority of those comments, as always, were compliments about your care here at Hines VA. The rest centered around concerns and recommendations. Next slide, please. Your top compliments, you talked about the quality of care you receive here, our amazing staff and how you interact with them. But you also told us about your concerns, about phone issues and getting connected with your providers, and how you felt about that. We heard you, and we worked consistently with our PSA team here to really meet your needs and ensure we can streamline that process. Next slide, please. And then our trust scores. As always, Hines VA strives to meet the needs of our veterans, ensuring that you trust us with your care. And you always ensure that you do, responding, or as you can see, over 94% of veterans who come to Hines VA trust us with their care, exceeding the national benchmark. Next slide, please. And we break down with the facility, our CBOCs, and all of our surrounding community providers. Even throughout the community, you trust us with your care. From LaSalle to Hoffman to Joliet, you trust us, and we're meeting your needs every step of the way. Next slide, please. And across the board, you look at different ages and genders. We exceed and meet the needs of our veterans across the board, reaffirming no matter where you are, how old you are, or where you are in your life, we are here to serve you and meet the needs of every veteran and patient who walks through our doors. Next slide, please. And of course, our Hines Patient Family Advisory Council. Just so you know, our Hines Patient Family Advisory Council is looking for more members. Our council is dedicated to working with our ELT and also our Hines employees to meet the needs of our veterans. Our Hines Patient Advisory Council serves as a liaison, really amplifying the voices of our veterans, ensuring meeting their needs proactively. We're looking for people to join. If you are interested, please contact myself, Candace Kent, at candace.kent@va.gov to learn more. Next slide, please. And as always, we are always listening. If you have any questions, concerns about your care recommendations, please reach out to your provider or the department. Again, patient experience starts at point of service, and we want to ensure we're meeting your needs. By chance, if you can't get a resolution or want to escalate a compliment or concern, please contact the Patient Advocate Office at 708-202-2716. Thank you. And next, I have Jesus Molina with Outreach.
Hello, my name is Jesus Molina, and I'm an outreach coordinator for Edward Hines Jr. VA Hospital. Our outreach team, along with the various programs, are busy participating in various events throughout the summer. I want to highlight some of those events and hope to see you there. The outreach team will be at the Health Fiesta Fair on Saturday, June 14th from 10 a.m. to 3 p.m. The fair will take place at the Hawthorne Mall in Vernon Hills, Illinois. This fair will have several communities and not-for-profit organizations offering services and information. On Tuesday, June 17th, our outreach team will be at the Senior Resource Fair from 10 a.m. to 2 p.m., hosted by Aging Care Connections. The event will take place at the Seniors Assistance Center in Norwich, Illinois. This event is for older adults, caregivers, and community members who support older adults. The outreach team and suicide prevention will be attending a Juneteenth celebration on Saturday, June 21st from 11 a.m. to 4 p.m., hosted by the Village of Westchester. This event will take place at Gladstone Park in Westchester, Illinois. This event will have live entertainment, food and retail vendors, kids activities, and much more. Edward Hines Jr. VA, in collaboration with Harper College, will be hosting a Veteran One-on-One Vet Assistance Expo on Saturday, June 28th from 10 a.m. to 2 p.m. This event will take place at Harper College, located in Palatine, Illinois. Veterans and their families can stop by and receive assistance with healthcare enrollment, VA disability claims, and much more. To learn more about these upcoming events, you can visit our website at va.gov/Hines-health-care/ and click on the events tab.
So as you can hear, we have a lot of great activities happening at our facility and beyond. And actually today we held our Caregiver and Family Resource Fair, where visitors could come and explore a wide range of resources available to them here at Hines, at the VA, across our VA enterprise, and within the community. A big thank you to the Gary Sinise Foundation for providing light refreshments and ice cream today. If you missed the event and want to learn more about caregiver services, please call Hines at 708-202-8387 at extension 28181, or you can call our VA National Hotline at 1-855-260-3274. If you're interested in learning anything else about Hines, or just to explore the opportunities that we have, please utilize the resources that was shared earlier in this presentation. Thank you so much for joining us. Our next town hall will be held August 13, 2025. Take care.